Well, let's talk about health matters now and show you some devastating pictures. These are patients who are stranded. Mostly some of those beds are really empty because the health services across various hospitals in the country remained paralyzed as the health workers' strike entered its 8th day today. Despite the back and forth between the healthcare workers and the employer, clinical officers and nurses have vowed to keep off their workstations until all their demands are met. Raquel Muigai has more details.
At the Kiambu Referral County Hospital wards, faces of dejected family members stranded with their next of kin was the order of the day. Patients with outstanding medical bills being the only ones left agonizing on their beds. Those seeking services quickly turned away as the healthcare workers kept off their workstations.
Unawezaona kwa hii wodi mzima venye umekuja ni sisi tu tumebaki. Hakuna watu wengine na sasa situation nika tunashinda tukiambiwa each and every minute tokeni.
Sasa usipokuja kuona mgonjwa hata kaifa simona mashuka ndio hizo umeanza kuzitoa.
Kama niko na ugonjwa wa roho, niko na kidonda, niko na mambo mingi nahitajika. Vingine mingi 90% zimesimama.
Other hospitals in the country read from the same script. In Nakuru, more than 200 clinical officers and nurses employed on contractual basis today joined their counterparts employed on permanent basis in downing their tools over what they term as the county government's refusal to address their grievances.
Some of us have worked for 5 years in Nakuru County under the contract. We have never received pay slips. There is no any allowances. There is no risk allowances despite working under the same conditions as those on permanent and pensionable.
We've all gone to the same schools. We've all done the same practices. We work the same duties when we come on duty. But it is very, very, very disheartening when I'm sitting next to a colleague who is being paid twice as me, who is receiving other allowances. When they go for industrial action, I'm the one left to man the office.
With the strike entering its 8th day today, healthcare workers in Nairobi held a procession to the Ministry of Health headquarters, accusing the government of ignoring their demands.
Right now, the super spreaders of COVID-19 are medics because of lack of PPEs. So we are not doing this for ourselves. We are doing this for the sake of the country.
The lives of health workers and their family is also important. More important than the BBI.
We want to condemn hata wale magavana wanaosema BBI is much more important than the lives of our people.
2 hours later, and with no response from the Ministry of Health, the health workers proceeded to Parliament buildings to present their petition. Their key grievances being provision of adequate quality PPEs at all levels, that all clinical officers belonging to the vulnerable group be exempted from active frontline duties and be directed to work from home. Additionally, they demand that their health risk allowance be harmonized and increased to 30,000 shillings to cushion clinical officers from financial stress. They also demand that there be recruitment and employment of 3,000 clinical officers and 7,000 nurses on permanent and pensionable terms.
Na vile ambavyo tunasema tunafungua shule na pia tunaanza tu mambo ya kiuchumi, itakuwa ni vigumu sana kujikinga kama clinical officers hawayuko katika kazini.
And as the crisis in the health sector continues to bite, 163 people tested positive for COVID-19, bringing the number of confirmed infections in the country to 92,055. 6 patients also succumbed to the disease, bringing the cumulative fatalities to 1,593.